Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hello, everyone. I'm back again with another episode of BioNexus Health Podcast series, Autism Uprooted. So today, let's continue with where I left off last time. I was speaking about the top 5 reasons why your child is not improving. So today, I shall be speaking in brief about travel. Once again, this is in response to several questions that have come forth to me, asking me to address the issue of how to travel safely. Now, that is a big reason, when you go on vacation, when you travel, or for any other reason, if you're moving home or you're going to visit friends and relatives, that constitutes travel as well. So let's talk about this whole thing, step by step, right? Step 1, if you're traveling by plane, by airplane, right? If it's an international flight, if it's a domestic flight, short flight, long flight, there are a few things that help. I touched upon this a little bit in my exposure podcast. So regarding exposure, so why don't we start with that first, yeah? So regarding exposure, understand that there are several tens, even a couple hundred bacteria, viruses, possibly additional toxins like mycotoxins that your child or the whole family, whoever is traveling, might get exposed to during traveling, okay? So how does one deal with that? One is basic precautions during a flight, right? Just remember, even before that, just try and keep the whole process stress-free for your child as much as possible. If you need to do some of the calming herbals, a little extra, sometimes even double the dose, depending on the age of the child. Like, shoot me a message through the online patient portal, right? Messaging center. And I'll be happy to, myself, meaning my clinical staff, will be happy to clarify the exact dosage for you, when you're traveling. So extra dosage of any of the calming herbs is fine. Then make sure that there's plenty of time, there's no rushing. Make sure that you go a little bit early so you can, try and avoid like heavily crowded spaces. I mean, I understand that airports are usually always crowded, but it's not literally always, like I remember I used to prefer to take an early morning flight, like, usually 6 o'clock flight. So we would wake up at like 4:30, get in the car, or, and then get to the airport. And there really isn't that heavy of a crowd then, and Brian was easy enough. He would wake up and then, keep napping in the car on the drive to the airport. And then once again, nap at the airport or nap on the plane. It just worked out really well for us. But that seems to help, right? Now, second is, don't be shy to wear masks. I know with COVID, it's become commonplace to see someone with a mask on. But remember, you do what is required for your child's safety. That's it. So, if you need to have him in a mask, if he or she is able to wear a mask, for short durations of time, that's fine. Now, organic cloth mask with a PM25 filter, right? There are many organic masks that are available out there. They have that are organic cotton and that have a filter pocket for a PM25 filter. So that is like double or triple the protection that a regular mask would offer. And that mask works best. Now, in addition to that, inside the mask, if, what helps is if you take silver spray and spray on the inside of the mask. So that is even more protection for your child. So all of these things, do as much as you can, see what is doable and what is not, and, just do the best you can, right? I'm going to give you, what we did based on my experience, and you can just pick and choose whatever is feasible to you, right? All right, so that would be the mask. Next is during the flight, I always recommend that you take your minerals, electrolytes, and Formula 1 NSB nasal spray, as well as daily OM blend. O for orange, M for Mary. So daily OM blend. These two herbals are very important for in-flight safety, right? From in-flight microbial safety. Additionally, you have the option of taking the BTXD blend, the biotoxin detox blend. If it's sometimes the planes are older, there can be mold toxicity issues. I know I've seen that, it's pretty gross, but usually when people sometimes have accidents, they throw up, etc., right, due to nausea, motion sickness or whatever, it's not necessarily steam cleaned. Okay, don't be under the impression that airplane carpeting is like steam cleaned, it's sterilized, it's spotless. Hardly. That really doesn't happen. And I'm sure that there are many articles online discussing this as well. It's pretty common knowledge that airplanes can be pretty gross. So make sure that you have adequate protection. So Formula 1 nasal spray, 1 spray each nostril every 4 to 5 hours is a good idea during the flight. Then BTXD blend and daily OM blend, 5 drops, okay, every 3 to 4 hours is excellent idea. So this way you have a child who will stay hydrated as well as have antimicrobial and anti-mold protection. Beautiful, right? Now, minerals and electrolytes, any good ones out there, if you are close to a health food store, then you might find, certain electrolytes available in like small sachets. So you might just want to purchase that, so those like little sachets are like travel friendly as well. I can't recall the name of a brand. Which one? Yeah, I can't recall the name of any brand that has those travel sachets, but any, right? Literally any electrolytes and minerals is fine. Now, minerals of life that you use in the protocol, those are fine as well. If you just want to put those in a 2-ounce bottle, so it is carry-on baggage friendly, that would be perfect. But staying hydrated, okay, properly hydrated is very important. So, all of your mucous membranes are moist, and you don't have any bacteria or viruses sticking to those mucous membranes. So stress-free, antimicrobials, anti-mold, and what did I just say? Minerals and electrolytes. So hydration is key. Okay, so when you're traveling. Now, in addition, my son used to have a lot of EMF sensitivity, right? It would set him off. Symptoms would appear, motor tics would appear. So what we used to do was we always gave him an underwear, undershirt, and a hoodie that was EMF protected. Again, if you need additional details, feel free to send a message through the patient portal and I'll give you additional details. But yes, so we did that. And one time, just as a fluke, what we said we would try was detox foot patches on his feet. So we actually did that. We put foot patches. I did that for myself as well, because it was a really long flight to see Dr. Klinghardt all the way in Seattle. So it was a 7-8 hour flight, in flight time, right? Not to mention airport and what have you. So that's a lot of EMFs, as we know, at the airport. So we applied foot patches under the socks, put socks on and then put sneakers on. So it worked out fine, now, after we landed, both of us, Brian and I kind of felt that the foot patches were, beginning to feel squishy. So right after landing, we just went to the restroom and took off the foot patches, and oh my gosh, they were like completely dark brown, soaking, almost spilling out. And, I must say that we had a really good flight. Usually Brian would get a lot of vocal tics, eye blinking motor tics, facial grimacing motor tics, head shaking, head nodding motor tics as well. We did not see those. And so that seemed to have helped, right? So these were, any good organic detox foot patches. There are many brands available out there. Autism parents usually know about these innovative things, don't we? So that's another option, right? Depending on your EMF sensitivity level, toxicity level, depending on the duration of the flight. Okay, now, cleanliness. I used to take, in the beginning, I used to take, tea tree, I used to take Formula 2 essential oil spray. So this is Formula 2 EOS, essential oil support. You can make a beautiful antimicrobial. Now, remember, Formula 2 is absolutely phenomenal, out of this world. It has 11 organic antimicrobial essential oils. So it is, the best you can get. And that's what I do. I usually travel with that. I make a concentrated travel spray, once again, in a 2-ounce bottle. I usually take 2 2-ounce bottles, one in my carry-on and one in my checked baggage for the return flight. Or, if we are in a rental car, etc. So that's, I know, right? Lots of considerations. But anyways, so using the spray, it smells great, right? It's not like bug spray, that smells like citronella bug spray. No, Formula 2 smells great, even when diluted, right? In order to make a spray. Once again, just send a message and we'll send you the spray making recipe if you're planning on traveling. Anyways, so what I usually do and what I usually recommend is, before you sit, first of all, we always used to carry my son's disabled state ID. And, thankfully, most of you don't have that issue, but with Brian, we used to have a wheelchair and what have you. So we were able to go in a couple minutes before others would go in. And, because of that, we had a wee bit extra time to be able to spray the environment around our seats. I sprayed, under the seat, on the side of the seat, above as well. Under sorry about that, the alarm went off. But anyways, but under the seats in the front as well. But I'm laughing now, but at that time it was a lot of precautions that we had to take. We had to travel for doctor's appointments, right? For all of you watching, that I do virtual appointments. So all of the test kits, all of the supplements, you get everything, including the consultation sitting at home. So that wasn't the case back then for me. So anyways, antimicrobial wipes, right from 2009, 2010, we have been doing this. We've been wiping everything down, the seats, the food trays, and the side cup holders and what have you. So all of those need to be wiped down properly. Okay, so this is, I think I've covered a lot with the airplane travel. Now, all of this also applies to traveling by car, right? The other thing that applies to traveling by car, it also applies to airplane travel, is we used to have an air purifier around the neck. So there are portable air purifiers that can be USB charged, that go like a necklace around the neck, and you can turn them on. So you have like purified air in this space. So that was another thing we did. And the same thing can be done for the car, but there are also excellent car air purifiers which are available, right? So that might be an important consideration. Additionally, if you are flying and you're planning on renting a car, right? So at any kind of a car rental, take a car air purifier with you, along with the Formula 2 spray to spray inside the car, and the antimicrobial wipes to wipe everything down. So, a lot of this is common sense. The hotel rooms, right? Try and book, new hotel rooms. Or if it's either new or renovated, take proper air purifiers with you, one for the bathroom, one for the main living area, the room, and one for the bathroom is always important. Wipe everything down. I usually use antimicrobial wipes for the remotes, for the light switches, for as well as for the couches, the tables, the chairs. Additionally, for what am I forgetting? Yeah, the night lamps. The night lamps. Anywhere anyone else could have touched, I usually just quickly give it a wipe down, right? And then once again, internally, environmentally, I spray using the same spray. So that's for travel. Okay, make sure that you are taking all your supplements with you. Make sure that you are maintaining the schedule of the supplements that has been suggested to you. Okay, let me think for a moment. Am I forgetting anything travel-wise? Oh, you know what? Yeah, bug spray. Bug spray. Very important to avoid mosquito bites and insect bites when you are traveling. So bug spray. Good bug spray is very important, organic, right? Not the one full of DEET and chemicals and what have you. Make sure it is clean and clear bug spray. And remember that, natural bug sprays have to be sprayed every couple of hours in order to stay active, right? Because, there are no chemicals, they are all natural ingredients, and, they just have to be sprayed often, okay? So don't forget bug spray. Sunscreen really isn't something that I worry about a whole lot. Most of the kids, most of the people in my practice have such low vitamin D. I mean, vitamin D is absolutely welcome. Don't get a heat stroke, but make sure that you have a hat on if you're going to a warm area, but you don't have to slather on tons of sunscreen and what have you. Should be fine. Have fun. Okay, good. So one more thing to see if I have forgotten anything. No, doesn't look like I have. So I'm going to take a 2-second break here. Okay, I'll be right back. Just 2-second break. Hello, I'm back. Sorry about that. I just went back to check my notes because there was, I had a nagging doubt that I was kind of, forgetting something. This is illness. If you are planning on going on vacation and visiting family, right? I don't know if you can do anything about a moldy house. That would be a huge issue. But if there are any sick family members, right? It would be kind if they would let you know in advance, because it's best to keep your child away from anyone with an obvious cough, cold, sore throat, flu, because there is bound to be a flare-up, isn't there? I mean, if the house is moldy, there's going to be a flare-up. If there are window air conditioners, whether house or hotel, you can expect a flare-up. If you've taken the full protocol with you, that will help to kind of keep the flare-up in check. But I have heard reports of complete relapse as well, depending on the level of exposure. So again, that's why exposure was the number one, right? I think exposure is such a big umbrella. It just comes into into every point as to why your child is not getting better. Anyways, so today was about travel. And advanced preparation is key. Cooperation from family members, friends, whoever you are traveling to is very important. It's very important to have understanding family members as well. You hear strange stories. I mean, it's just sometimes very challenging to explain to family members that please don't feed junk food to my child, or he has autism, or he is on a all natural protocol and that's not allowed. If you want to go ahead and mention that trying to give your child fast food or any soft drinks, right, any soda, that is against doctor's orders. You can say that, or you can say that, doctor says that he's got severe allergies, he can have a bad reaction. So if that helps, right, whatever helps. But adequate precautions are important. Unfortunately, 99% of children who travel usually relapse. Okay, and this has just been, been personal after all the precautions that I've taken, but personal and a lot of professional experience, right? Now, if you have a choice, wait till you are a couple years into the protocol and the immune system being stable, at least 12 to 18 months sometimes, even with a child that's responding phenomenally well, because usually we see so many underlying issues. That is why we run labs, parents, so that you realize what your child's body is having to go through. So that gives you insight like, hey, we have so many toxins, we have so many microbial infections, we have the gut that is like seriously leaky. There are, so many environmental sensitivities, mold toxins. So you have a child that is in, fully loaded, so to speak, right? That has all of these things going on that he or she has to deal with. So give them time. It takes time. We cannot give a child an adult dose, can we, to just, expedite things. There's going to be a crazy die-off reaction or a crazy detox reaction, which no one wants to see. So discipline, sacrifices, good choices have to be made when you're trying to recover your child with autism. All right, well, okay. That brings us to the end of point 2 of why is my child not improving? And I'll be back soon when I have some time again to record point number 3 in the top 5 reasons why my child is not improving podcast series, right? So this is a mini series within the Autism Uprooted podcast series. I'm really glad you could join me. And I look forward to seeing you right back here. Now, please remember to subscribe. And, please also share the video if you have any friends, family, colleagues who you think we can help with this information. So, all right, great. I'll see you guys next time. Be well, take good care. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.